Hello, my viewers of Dr. BMS. I'm talking to you from my place of work. And today I thought I should speak about a way that I can reach out to you out there in your homes, in your offices, in your little businesses, and support you as much as possible in health matters that may be challenging to you, the BMS way, body, mind, and soul. I say this because I have observed that oftentimes patients come to me, families bring their loved ones to me in a state of distress. I get calls when things have gone out of hand and I have to intervene. In the course of intervention, I realized that if I had intervened or if this family had reached out to us earlier, then would have avoided this crisis that we are in. And this is particularly in the area of addiction rehabilitation or addiction, abuse of drugs, young people particularly getting into problems with drugs and having brushed with the law. They have been arrested, they have come home and they have caused a fight, and now there's a crisis in the home. They have been sent away from school, from college, or parents have just realized that their son, their daughter, who they thought is in school, actually never attends class and they were discontinued years, months earlier, and it's panic and crisis. But as we talk to these parents, if they have come to their center, to our center to bring their son or daughter for rehabilitation, we realize that they had noticed some peculiarities, some oddities here and there in their son, their daughter's life, but they didn't know what to do, or they were doubting that there's a problem. And you wish they had spoken just to an expert like Dr. BMS, just a phone call, and would have told them, if you are seeing this sign and that sign and that sign, that's already a sign of a problem. Do this and this and that, act in this way and that way, and the problem would have been resolved much earlier before it got worse. So I said, let me tell my viewers out there what we can do, what Dr. BMS and his team can do in matters of health to help you overcome some of the challenges that may come your way or your family's way. I would like to list a few of the key areas that we are able to intervene and invite you to book an appointment, come see me, book an appointment for an online consultation or a telephone consultation, and we can start the process of remedying the health problem that you may experience. We can start the process going as early as possible and get good outcomes in a cost-effective way because we did not waste time. The first area is the area I've mentioned of alcohol and drug abuse interventions. An intervention in this case is a scenario, situation where we as therapists come out to you before you come out to us. And this could be we visit you or we interact with you, even online, and help you understand, diagnose a problem of alcohol and drug abuse while still at home, in your family, and help you choose a course of action that is good for your family, for the patient. And this is particularly important because people in this kind of problem of alcohol, drug abuse are in denial, like I've said previously in the video. Sometimes they are unwilling to seek treatment. They feel shame. Sometimes they are fearful that bad things will happen to them. And all they need then is someone who can reassure them that it's not the way they are thinking. And that reassurance can make them make a decision or the family make a decision. Sometimes we find families that are divided, they're not talking the same language. And this intervention will help these families see the sense of coming together, talking from a common script, and solving the problem that is worsening in the family, namely alcohol and drug abuse. The second area I would like to inform you about is about youth behavior modeling and career progression guidance. As we've said previously in a number of videos, this problem of alcohol and drug abuse is affecting our young people more and more. Their numbers are rising and it's affecting how they progress in their careers, in school, in college. We are seeing an increased dropout rate, stagnation in school. Sometimes big discipline issues can arise because of this, and families come to us when things have gone overboard. Sometimes it's not easy or it's not possible to save because the ship has sunk. Someone has been expelled from college, they have dropped out completely, and now you have, or they've been expelled and you have to look for a new school. And so you realize that this problem was there for a long time. The family didn't know what to do about it, and now it has come to a head like this. We would like to encourage families to reach out, and we can start helping them how they can model the behavior of their young people in a proper way and guide them through their career so that they complete school and technical colleges, universities, and other areas of professional training and become responsible adults. We are also able to intervene in matters of parenting. We see patients brought to us with alcohol and drug abuse problem, especially young people in school, in college. And when you realize that this child got into addiction or abuse of drugs because of parenting problems. I've made videos in the past talking about daddy's girl, talking about mommy's girl, saying don't treat your child like your friend. And these are videos that are aimed to make parents see that parenting should be done in a particular way to achieve a result. It's not a game of chance. It is something that has to be done purposefully and with the right objectives in the right way. The results, the good results will be there. We are experienced enough. We are well trained. We can come and help you, especially young parents who may be feeling unsupported, like in the urban areas. You don't have the benefit of good neighbors who care or a community. We used to say it takes a community to raise a child, but sometimes you may find you're alone and you don't know. Talk to us. We are able to come and help you with the problems of parenting that you may be experiencing. In line with parenting, also marital issues, because remember, your parents, because you're married or you're in a long-term relationship, and so you may be having some issues that need ironing out between you and your partner. And so we provide that support, parental as well as marital guidance. You can reach out to us and we can help you early enough so that you make sense of what is happening and you know the solutions are there. You start applying them and you get good results. We also do psychological assessments. Psychological assessments are assessments, scientific assessments, to help you know yourself and to know your state of mind. You are of a particular temperament and your mind is in this state now and the foregoing. So if you are depressed, if you are stressed, if you are anxious, if you are prone to depression, stress, anxiety, if you have problems with interpersonal relationships, we will help you to understand yourself better through these psychological assessments, which we do to all our patients when they come to us seeking treatment for various mental and psychological health problems. We also provide support in terms of workplace training. workplace training in areas of public health and psychology of the workplace. This means that we can come to your workplace. If you are an employer, you have a little hustle, you have employed some people, you are in charge of a department or a big firm. We can come there and talk to your staff, to your employees about many topical issues concerning their health, body, mind, and soul. Dr. BMS all the time. So we can talk about prevention of infectious diseases. We can talk about work relationships, motivation of staff, productivity of staff, supporting staff who are in distress, they are bereaved, they are performing poorly, and they need to be summoned for disciplinary action. All areas of health that concerns your workers or you as an employee, we can come and help, train, we can formulate plans of actions, frameworks or policy documents that can help you steer your company, your employees, your colleagues at work in the best possible way for them to be good workers who enjoy their work and benefit from working, as opposed to getting stressed, sick, and disempowered because the work situation is not like it should be. We are also available to provide treatment in the center, like where I'm talking from. And this treatment will be clinical interventions along those areas I've talked about: alcohol and drug abuse, rehabilitation, mental health problem, parenting, marital, family problems, work-related problems that have gone a bit far, and this person needs to be brought into the center. So we admit patients and we treat them in these problems or conditions. However, like I said when I started, I wish that we don't just sit and wait for them to come, because we would like to lessen the burden, we would like to prevent where we can, and that's why I'm making this video, passing out this information, so that you as a family member who has a problem with yourself, with your spouse, with your child, at your workplace, and you see this problem is not getting resolved and is growing bigger, you can reach out to Dr. BMS, book a consultation, visit us, online consultations as well, and we can start solving some of these problems with you as early as possible. So, reach out to us early enough. Let us intervene, even in the comfort of your home, online, and in our center when you come, and we start helping you as early as possible. After we have interacted with you in a clinical setting, we have treated you, we have finally what we call the aftercare program. The aftercare program is about what we do to support you when you have finished the treatment in our center, and now we would like you to go out and try standing on your feet. But we are there to support you to see that you are strong enough before we let you be on your own.